Good afternoon, everybody, and happy Tuesday, almost the end of the month. Happy July. I hope everyone's having a good summer. My name is Leanne Swanson, and I'm the CEO of the National Center for Healthcare Leadership. And I'm so excited all of you have joined us today. I'm happy to be with all of you for our second town hall session this year. For those of you who've been joining us on our bi-monthly coffee chat discussions, those are shorter, casual conversations on a hot topic, but we're excited to bring 3 town hall sessions to the healthcare community this year. And this is our second one on a very timely topic. This is like the hottest topic, hottest discussion around right now on remote work. And so we're going to take a deeper dive and in-depth conversation on this issue. We have amazing panelists who are going to share their insight and expertise. And so I'm going to turn it over to Melanie Standish, who's going to help do her fabulous job of moderating the discussion and let the experts talk, and really appreciate a great discussion that we're going to have around this topic. So thanks again for everybody for being here and joining us.
Excellent. Thank you so much, Leanne. It's really great to be here with our amazing panelists today. Before we get started, my name is Melanie Standish, and I'm the program manager for our Leadership Excellence Networks at the National Center for Healthcare Leadership. As Leanne mentioned today, the topic is remote work is here to stay. So what happens now, which I think is a question on a lot of people's minds. Before we get started, just a couple of things. I did want to note that NCHL has a variety of different events, as Leanne mentioned, the different coffee chats, and we have several webinars. One of our additional upcoming events is related to transforming the payment experience for international development and advisory programs, so feel free to tune into that. The bit.ly link here can provide you to that registration link. But more importantly, I want to kind of introduce our panelists for the day in this particular session. So today we're welcomed by Tammy Bigelow, Career and Talent Development Director at Intermountain Healthcare. We also have Dr. Victoria Kennel, Assistant Professor and Industrial Organizational Psychologist in the Department of Allied Health Professions, Education, Research, and Practice at the University of Nebraska Medical Center. And then we also have Lauren Schmid, Executive Vice President and Chief Human Resources Officer at Carle Health. I anticipate that this is going to be an excellent discussion today. Each of you has had experience with remote or even hybrid work in different capacities, and will bring really interesting perspectives to the table. So without further ado, I kind of wanted to start off by setting the scene. So, prior to COVID-19, your organizations might have been in a particular situation related to remote work. You might have had lots of remote workers, maybe none at all. Maybe COVID-19 was the thing that really shifted it for your organization. So I want to begin with Tammy and Lauren, who will really be kind of our practitioner focused perspective for the day. Can you tell us a bit about your health system's work policies prior to the pandemic? And how did you pivot to a more virtual workforce, if at all, once the pandemic began? Tammy, we can go ahead and start with you.
Thank you, Melanie. We actually had we've had teleworkers or remote workers periodically throughout the history of our company. We've tried out certain tests along the way, but this was the greatest test of all. And we had the opportunity in June of 2019, our CEO sent out a blog to our caregivers asking them what HR policies they would like looked at. One of those policies was our remote work policy. And so we were able to start this work early on before the pandemic even hit. We were able to do some internal research, talk with leaders. And at that point, it was like, yes, we want to do this because caregivers really want it, but you need to go slow. So we did. We designed communication and some tools. And then we also did some testing with our remote work capabilities. So we had a really big snowstorm here in Utah at the beginning of 2019, which tested our remote work capabilities, and we didn't come out ahead of the game. And so we did some major improvements throughout the year. And then in January of 2020, we did another test. We sent as many people home as we could. We had 2 different days that they could test remotely, which really was a benefit to us, because when our mandate came in March to send about 25% of our population remote, we had the internal systems capable and ready. So it was a wonderful, great blessing.
Wow, that's amazing. I don't know if that's necessarily the story for everyone necessarily. So I think you would consider yourself in that particular situation a bit lucky. But Lauren, how about you? Tell us a bit about your health system's work policies prior to the pandemic and how that kind of shifted.
Yeah, I would say we were probably in that other camp where we really had not contemplated a large scale move workers to home. So we, Carle Health has a health plan, and the majority, which was even a very small percentage of our workforce that did remote work, was part of the health plan. And so we really hadn't thought about that on the provider side of things or in our sort of corporate services. It just really didn't happen that often. Occasionally, if people needed flexibility, we would do that. But when and I would say we were a little bit more formal in the work environment too. When March came, I mean, we literally told people, like, don't come into work or get your stuff and go home. And it was just a sort of like cross your fingers, hope that this works sort of thing, because we felt the safety of our employees was important. So would make the remote work happen as best we could. So we didn't do a lot of virtual meetings. Prior to the pandemic, if we needed to do like a remote option, it was a conference call. And now, it's sort of funny to do a conference call because we're so now accustomed to a virtual environment. And then, as we've brought people back into that non-clinical space, I mean, we haven't brought a ton of people back, but the ones we have, it's a much more informal work environment. So now people can wear jeans and, it's a much more casual environment. So it really kind of took the pandemic for us to get outside of our comfort zone in how we considered workplace arrangements.
Excellent, thank you. So we got both sides of the story here. We have an organization that was maybe lucky enough to escalate the remote work prior to the pandemic even began. And then we have a situation, maybe a story people are more familiar with, where it was this sudden change. So I'm happy to have both of your perspectives on today's call. Vicki, I'm going to turn it over to you. One of the things that NCHL really specializes in is evidence-based practices. And so as our honorary academic here today, I'm curious to know how you've kind of seen the research shift and how we talked about remote work and teams prior to the pandemic versus kind of what happened in the research arena when the pandemic began.
Sure, that's a great question, Melanie. So from a research perspective, there is a body of research around remote work, teleworking, telecommuting. But for many of us, we typically worked in an environment where we were expected to be at work face to face. And now we had this rapid shift and transition to remote work when that wasn't the nature, or arrangement that many of us, took on or asked for when we originally applied for our jobs. So there's been ample opportunity to really grow research in this area, specifically to look at, how do we transition from primarily face-to-face work, quickly transition into primarily remote work, and navigate that process along the way. Also acknowledging that the research that's happening at this time frame, especially early on in the pandemic, to some extent is confounded by that experience of living through the pandemic. Many of the traditional outlets that people would have, socializing with friends, going out for coffee, going to religious services, whatever that looked like, those outlets didn't exist anymore during the height of the pandemic, due to the public health guidelines and responses. So there's a lot of opportunity to learn about that lived experience of transitioning to primarily remote work on a pretty rapid basis, but also looking now at what does this look like as we hopefully eventually fully come out of the pandemic and people adjust to, different working arrangements, whether that's fully remote or hybrid, or other combinations.
Thank you, which is a perfect segue into kind of my next set of questions here, because we've talked a lot potentially on other things you've maybe been a part of or conversations about this whole shift from pre-pandemic to we're in the pandemic. And now what everyone's asking is, okay, well, what happens now? So a lot of people have been given the option to work remotely. Maybe they hadn't before. So what are policies going to look like moving forward? Tammy and Lauren, I'd love to hear about how your organizations are handling remote work going forward, and specifically what types of challenges you've faced along that journey. Tammy, if you want to discuss first.
Sure. We have done a lot of internal work over the last year to gather employee perspective. We had our executive leaders kind of give us job profiles that could remain working from home, and manager connection. We've really stayed with our caregivers to make sure that the work is being honored in the right way and caregiver choice is being honored as much as it can be. So through all of that work, I think one of the biggest challenges that we've experienced, we have great feedback. We've pulsed our caregivers throughout this entire wonderful experiment to see how they were doing work-wise, emotional-wise, connection to team, and clarity on work priorities. And we've had some really good results. Now, as we have transitioned back, we've actually opened our office spaces as of July 1st. And so we have individuals transitioning back into the workforce. About 76% of those eligible for remote work have chosen to stay working remotely. So we have a large population who will continue doing so. Those others are by way of desire or by way of need working in the office. And the harder conversations come when the employee wants to work remote, but the work doesn't support that yet. So we've had to transition a few individuals back into an at-office location that they weren't extremely excited about. One of the opportunities I've had is reaching out with leaders and making sure that we have equitable access to this opportunity across the board. And so just working really closely with them. Some other things that we've looked at is this connection to organization and team. And so we've started this year what we call our Teletalk series, their Lunch and Learn series that brings all of our telework community together twice a month to learn about up and coming topics, things that are new, very much focused on remote work capabilities, kind of bring that upskilling element and connection both together. But we've had great feedback, some heartbreaks for a benefit that they want and can't have right now, but a lot of internal due diligence to make sure that it's right for the organization and our caregivers.
Excellent, thank you. And just a clarifying follow-up question, is this both for clinical and administrative roles at your organization that this is happening?
So yes, we started with all of our operational roles, right? So anybody that's attached to a health plan or an office, that's where we started because that was the majority of our remote work. We do have a very specific arm when it comes to kind of our telehealth services that is participating in this as well. Our next phase, once we get stable where we're at and do everything that we need to with these audiences, is really moving into our clinical population to identify where we can add greater flexibility to those job environments as well.
Excellent, thank you. Lauren, how about yourself? What's kind of the next steps for you moving forward at your organization?
Well, we, like what Tammy described, we surveyed our team members, our leaders, to better understand their experiences, sort of what worked, what didn't, what are your preferences, what equipment needs are you missing that you need, trying to get a better assessment of, the gaps that we might need to address. Through that, I mean, we ended up doing pretty well for not having the plan ahead of time. We fared pretty well. What we have seen is from more of our non-clinical administrative type of roles, those are primarily located in one building. And those we've evaluated and assessed probably about 65% of those roles will move into a hybrid type of role. So some opportunity to come into the office, but most of that likely being work from home. So predominantly what we heard, were two main themes as some of the challenges and things that we've worked on and we continue to look at. One from a leader perspective was around productivity and how do I measure productivity of my team, that what the nature of the work they do is very service oriented and it isn't quantifiable. So how do we, it's rethinking about how what the work is and how you could measure that effectiveness, or creating more touch base with leaders and teams around progress of projects or things like that. So we're continuing to evaluate that. We certainly had a little bit of a challenge acclimating new team members and training them when there really wasn't an opportunity to do so on site. So we've adjusted a lot of onboarding practices as well to help new employees that are coming into that administrative environment adjust immediately to a hybrid or being trained fully from home. And then the other part was just maintaining a connection. We are very fortunate to have strong engagement with our team members and wanting to keep that as a priority. How do we continue to facilitate those opportunities for people to get together? We don't have organizational events look very different than they were. So we don't have those natural times where we get together. So moving those virtually, and even that has shifted because people have gotten tired of the virtual happy hour, or the virtual get to know you, or team building sessions. So we continue to have to, rethink how do we support that connection and engagement over time. The other thing I would say that is potentially a challenge that we're working on is this pandemic has really magnified any vulnerabilities in our culture that we had. So we had a very relatively stable workforce, not a lot of turnover, or it was very manageable turnover. Of course, we had challenges here and there, but generally pretty stable. Competition for talent was, again, manageable. And now when we have individuals who don't have to relocate and have a new job and they can work somewhere else, it's really refocused our attention on our comp and benefits programs. And again, it goes back to that ensuring there's a strong connection, because people love their teams, really stay or leave as a result of how they feel with their leader. So that building those connections in a new way has been important to maintain stability in our workforce too.
Thank you. I'm hearing a lot about, the importance of maintaining connection and the difficulties maybe with onboarding leaders who might be entering a remote or hybrid environment. Vicki, I'm interested to know anything research-wise that you've heard about the unintended consequences of fully remote or even hybrid work policies that are coming up in some of the research questions that you've been asking.
Yeah, that's a great question, Melanie. I go on about this forever, so I'll try to keep this down to a couple topics. The first unintended consequence that always comes to mind is the impact of FaceTime bias. So how can we overcome that negative impact of FaceTime bias, which is where employees who are seen, in the workplace, whether they're working or not, they're simply visible at work. We tend to think of those employees as more responsible, more dependable, and oftentimes they'll receive higher performance ratings and perhaps even more promotion opportunities than those who are less visible in the workplace. So thinking about, especially in organizations where we might have a mixture of fully remote, hybrid, and fully in-person employees, what can we do to raise awareness about that often unconscious and very subtle influence of FaceTime bias, so that isn't something that our remote and our hybrid employees have to feel like they're concerned about, because that may ultimately influence some of their decisions to take a hybrid position or to switch to more of a fully remote position. To Lauren's point, we can address some of that by using objective output measures to the extent that we can to help measure performance and productivity. We can also think about including peer feedback in some of our performance appraisals. Those are some strategies we can try to use to try to mitigate some of those effects. Effective team communication is another, area, I think, of interest for everyone, particularly how can we generate new team communication strategies that don't result in email overload and meeting overload. I think many of us experienced that when we were working primarily remotely, because we missed out on those opportunities for quick hallway conversations or stopping by the office to ask a question, or even that it's amazing how much work got done right before a meeting started and right after a meeting ended, because you could catch people for quick conversations. Those opportunities were lost. And I think many of those have turned into lengthy email discussions or a half an hour meeting that was previously done, within a minute or two. So within our own department, here at the university, we've been exploring, what people feel about email overload and meeting overload, and trying to generate some new norms and some best practices that we can use to try to mitigate that, and looking for other opportunities for asynchronous communication, to kind of free up people's schedules to be able to focus on their work. And then a final opportunity, I won't talk about this much because I think this is a question for later, but just thinking about leadership development. So what do we need for leaders to help them have self-efficacy and skill to lead teams in in-person settings, in hybrid settings, and in fully remote teams as well?
Thank you. And I'm going to kind of jump back to a point that Lauren actually made earlier related to recruitment and retention, because I think that's something that organizations are potentially struggling with. You have kind of two sides of the coin. On one end, remote work might allow you to have this new pool of candidates that you've never imagined you could have before. On the other hand, you have people that if your world isn't fully remote, they might be leaving for new positions to say, hey, that's over there, I'm going to go. So I'm really curious to know about how remote or hybrid work has impacted retention and recruitment at your organizations. And I'll ask this of all three of you, if you could just reflect on it. Lauren, I know you mentioned it a little bit. Is there anything you'd like to add to what you've already said?
I think one of the challenges that we're certainly expanding sourcing. So some of it's teaching our recruitment team, okay, now, the normal places where you sourced applicants, we now can think bigger. We can now think in a broader context. So that's a step in the process. The other is understanding the employment laws of various states, and understanding, is that worth, if we find this candidate in, X state, is that worth it because they have different sick leave policies than what our policies are? So there's a lot of back and forth that we're working through right now on assessing, like, are there states we just don't want to go to, or are, or we're not ready for that. We don't have the infrastructure. So our HR system's a little bit old. We're moving to a new one in the next 18 months. But as we're doing that, we're looking at being able to administer multiple benefit plans and track across various states, because right now that has to be done manually. And we have, the same set of team members that we did before, trying to manage it when everyone was the same. So those are some challenges that we're working on from a back end sort of administrative perspective.
I just have to echo those challenges. We're facing those as well. In fact, we've had to reach out because we have a purposeful strategy to be able to recruit outside of our service areas. But in order to accomplish that, we have to overcome exactly what you talked about, Lauren. We're looking at partnering with some external experts to help us understand all of the laws that go with it. We pulled into kind of our recruiting channel a training to help recruiters educate leaders on positions that can look for remote, because we had this little bit of fear and phobia. And so really educating and opening that opportunity up from the leader's perspective has been something that we focused on. And then I actually had a caregiver population in one of our clinics reach out and say, we cannot get individuals for this job category. Can you help us figure out how if we could pull in some more flexibility and how that might help? And so we're seeing that there are, even in our clinical spaces, there is room to add this as an opportunity to really expand that recruiting pool. But it is not something for the faint of heart. It's a little challenging.
Vicki, anything you would add that's going on maybe at your organization?
Or it's, being more on the academic side, it's a little more difficult to answer this question from an employee perspective, but I can certainly say from, recruitment of students and applicants to, health professions programs. Many students are looking at, different ways to do things like campus visits, information that's put on the website to promote programs, but also learning about how different health professions programs provided support to students, through this initial transition away from traditional face-to-face learning to primarily remote learning in some circumstances. And how have those programs really engaged in a lot of innovation to make sure students can stay on track with meeting milestones and requirements in their education, so that they're fully prepared for their professional exams and for entry into the workforce without significantly delaying or adding additional time on to the completion of their programs.
Thank you. Yeah, the student perspective is definitely an interesting one. I'm sure that's a new thing we'll be facing as new careerists enter into the workforce as well. If a lot of your college or graduate experience has been remote, and how that's going to impact new employees coming in too. So thank you for providing that perspective. I am going to turn it back over to you and kind of pivot the conversation just around development. We're in this more virtual world now. So how can health systems really develop and prepare their workforce for this new world that we're in? And specifically for you, Vicki, I'd love to hear more about some of your research on effective remote teams, and how does what you have learned translate into meaningful or actionable things that organizations can take to educate their employees to be effective in a virtual environment?
One of my specific research and practice interests is on effective teamwork in healthcare. So we know that effective teamwork is essential for high quality and safe care. So one of the directions I'm taking my research is starting to look at what are some of those teamwork skills that are needed for healthcare professionals, for health profession students, but also thinking about our patients and family members and caregivers as part of the team for when we're working in virtual care teams. So for using telemedicine or other mechanisms for care delivery. And how can we create some meaningful, interactive team training and education experiences to help all these individuals develop those skills? So in the initial transition, when the pandemic hit, a lot of education related to virtual teams or even telemedicine was necessarily focused on like the tasks and the technology. So what do we need? How do we use it? How do I complete my work and do the tasks now, so I can make sure I get my work done? But we're interested in more of the team dynamic aspects, the communication, the coordination, the leadership elements that go into that as we're learning to work under some of these different modalities. And then from a workforce development standpoint, many health professions programs are starting to integrate interactive or simulated telemedicine experiences into their curricula. So for example, in our own college, we are just finishing up a kind of a modular-based telemedicine course for our allied health students. We're also working on some other interprofessional education experiences for students where they'll learn to use telemedicine and telehealth technologies while they're also learning to interact and work with each other in a virtual team setting. So this is exciting for kind of from a workforce development standpoint, because we'll be having health profession students ready to enter the workforce with some of these skills kind of under their belt as they come into the workforce.
Excellent, thank you. I do have a follow-up question for you, if you don't mind. I'm curious to know, we have this concept of completely remote teams versus hybrid teams, where some might be virtual versus some might be in person. And maybe you don't know the answer to this question, the research might still be out there, but is there a major difference that you see between what a hybrid workforce looks like between an all virtual team?
That's a great question. And some of that I think comes down to how the team members are interacting. So if we're thinking about meetings or collaboration opportunities under a hybrid setting, we may still use the same types of technologies and modalities to communicate. It's just that some of us are maybe present in an office and others may be, working remotely. There are definitely benefits of the hybrid approach because you'll have some opportunities for in-person interaction that would be lacking for those who are working in a fully remote team. So how we socialize and how we develop team norms may be a little bit different for purely hybrid teams versus fully remote teams. But these are all areas that are wide open for research as we continue looking at these new models of working and how we can help to optimize that work experience and teamwork and collaboration within them.
Thank you. I think my research brain started asking all the different potential research questions. So thank you for indulging me in that question. So shifting to more of a practice perspective, let's start with Tammy here. What has your organization considered when thinking about training your leaders across all different working contexts, from the in-person to the hybrid to the completely remote?
Yeah, it has been a beautiful learning opportunity, and we have just instituted kind of our first year journey for our leaders, where they have various points of contact with other leaders and networking, purposeful networking, but also kind of the educational pieces that go along with it. So this journey takes them through kind of the practical skills based of leading in-person and remote teams. We just fully believe that if you're a leader at Intermountain, you are a virtual leader in some sense of the word, because of our groups that are not always present in various different locations. And so we've really build that into all of our leadership development, that you will be at one point leading virtually, connecting virtually. So this journey really takes them through all of those points. But I think the greatest thing that we've looked at is that purposeful mentorship across the organization, to build that connection that you don't get by sitting someone just next to you. The other thing that we've done is really tried to educate leaders on when to bring teams together and what types of work could or should be done remote, and what types of work could or should be done in person, and bringing together, now that we can gather, that collaboration that can be done in purposefully connecting in office for the strategic benefit.
Thank you. I think someone brought this up earlier, but it's like this concept of when you're not face to face, you don't have those moments of, catching someone in the hall or something like that. And I think that's a lot of something that leaders are potentially grappling with, is how do you make sure that every employee has intentional development when they don't have those face-to-face opportunities? So that intentional mentorship, I think, is a really, really interesting concept. Lauren, how about yourself and your organization? What are you thinking about in terms of training leaders for these different types of environments?
We've looked at it, from a large, like sort of overarching what's needed, and then sort of a technical, what are the toolkits necessary to achieve. But, of course, during the pandemic, there's also a social awakening in our country. And so there's a lot of focus around equity and inclusion. And so as you think about your workforce changing with that element, that becomes really challenging. And so we had, where we're trying to facilitate real conversations about what's happening in the world around us, and doing that with people remote, and some people are on camera and some people are in the office. And, that dynamic is, on a sensitive topic, nonetheless is challenging. So we've really focused around equity and inclusion, unconscious bias. I think Vicki was talking about that a little bit. We've been training leaders a lot around that, how to, so from a technical toolkit standpoint, we've also covered a lot of mental health. So we've done a mental health first aid series for leaders and for team members, recognizing the pandemic and what's happening in the world around us affects people in different ways. That equipping them with tools and equipping leaders in particular with what to recognize as signs for help or ways that you can reach out to assure that your team is okay. And them too, right? This has not been easy for anybody. I think, our leaders have struggled as well, feeling like they're supposed to know the answers to everything when they're, or make decisions on things that there doesn't seem to be a good decision to make. So making sure focus on resilience as well. We've looked at also, when we were sort of following I don't even know, kind of the initial run of the pandemic, and we started to bring particularly some of our clinical staff back in and started operating more on elective surgeries and things like that. We started bringing some clinical teams back in. We created training around how safety in the workplace and what that looks like during COVID-19 and what you can do and sort of assurances that you will, keep the right PPE and how to talk to people who aren't wearing their mask correctly. How to have a conversation with somebody about their vaccine status, because that becomes a little political at times. And so teaching people, here's sort of the do's and don'ts on how to have that conversation in a respectful way. So, we've kind of run the gamut throughout the pandemic on different topics, but we also have been doing town halls, virtual and town halls, where we're gathering insight from people. What do they want to hear about? What are their challenges from a leader, a medical staff, and all team member perspective. And that has helped us keep in touch with what they need and supplying training that fits at the right time.
Thank you. There's definitely a lot of different areas for upskilling that has occurred over the course of the pandemic and continues to. So you make some really great points about all the areas in which the pandemic has kind of impacted training for leaders. I didn't add this question to kind of our agenda for the day, but Lauren, you brought up diversity and equity and inclusion and kind of incorporating that. Tammy, I'm curious, in discussing your flex work policies, and even prior to the pandemic, since you actually created those policies potentially beforehand, how were equity and inclusion kind of incorporated, if you don't mind my asking?
No, that's great. And we've had to go back and make sure that everything was in there, given what we've experienced over this last year. We really focused on keeping a lot of things virtual, actually, to include, like when we have made decisions about what will training and education look like moving forward, we made some purposeful decisions to keep a lot of things virtual so that we could expand that access. So when we look at that equitable access to learning opportunities and development opportunities, that was one of the things that we had to go back and make sure that we were doing what we needed to do. And then we've added we do a yearly survey, experience survey, and we've added a remote work element to it so that when we get our information back this year, we can very strategically look at teams who have a hybrid environment, teams that are completely remote and teams that are completely in person, so that we can do some analysis to see where we're missing the mark, where we need to increase, or I'm sure we'll learn some wonderful things there. But it's been something that we have, I won't say struggled with, but had to be very purposefully and intentional to include in what's coming and the strategy moving forward, where it was there, but not like it needed to be prior pandemic.
Thank you. I think the concept of the combination between equity and remote work is very important, because if we talk about what's happened in the past is it 15 months now, equity and the pandemic are two things that definitely strike me as two of the most important things that have become conversations. So I appreciate you talking about that. Just for the audience's sake, real quick, I'm going to be asking a final question kind of for the entire group. And if you would like at this time to put any questions in the Q&A or in the chat, I'll be kind of talking about those after I ask my final question. So now is a good time to do so. So kind of in summary of our conversation here, we talked about what happened prior to the pandemic at your organizations and in research, how that shift changed the way we work, kind of what's going on moving forward, some of the challenges for recruitment, retention, development. So I'm curious, after having this conversation, for each of you to kind of provide maybe an insight or a question for everyone's consideration. Like, what is one key lesson learned or question that leaders could be asking as they develop the future of remote or hybrid work in the healthcare sector? And let's see, I'll start with Vicki here.
I had to think a lot about this question prompt when I was preparing. So I'm gonna pose a question for leaders that's maybe a little bit different than what we've been talking about. It's thinking about how we're framing this situation. So how can we approach this future of, you know, remote work, hybrid work, in-person work in healthcare as a quality improvement initiative? You know, thinking about what are the specific problems we're trying to solve or the opportunities we really want to capitalize on as we make decisions. You know, what are the process and outcome metrics that matter the most to you? And how, because this is so new, and admittedly the research is so new, there's not necessarily a really strong clinical evidence base we can, you know, look to for the right answers. You know, how can we use methods we know, like rapid cycle improvement methods, to experiment with and iterate with our policies and our processes, and I'm taking that testing and learning approach as we're really redesigning the future of work.
Thank you. Tammy, how about yourself?
You know, I really think being intentional is vastly important. We have experienced so much and we've had to do so much on a whim just to survive. But as we look at moving into the future, being intentional about what has worked and what hasn't worked and why. I've had leaders that just have said, nope, everybody comes back to the office. And so I've had the opportunity to connect with them and ask them, why, what needs to be done in office? If it's worked for a year and a half, what needs to change now? We've had to change a lot of processes that were unfortunately paper-based. I didn't realize how many paper-based processes we had in our organization until we went remote. But it's being intentional about what it is that works and purposefully making decisions that allow the team to really enhance what works, and then identifying what doesn't work. And if it needs to be part of what the package that you're offering, figure out how. So we've uncovered a lot of things that we were able to gain some really quick wins because they were just things that we hadn't thought about. I always ask teams I'm working with, what's another right answer? Because we get kind of stuck in the way that we've experienced it. And we had some that were like, oh, I can't wait to get back to normal. And so I'd ask them, what does that look like? Because nothing will ever be normal according to old standards again. So it's that really intentional purpose, and every voice matters.
Love that. Thank you. Lauren, how about you?
You know, I had a hard time sort of distilling thoughts around one thing, but when I think about the past 18 months or whatever it has been, I think about, you know, we have been faced with a number of situations that really just felt like were painful to step through or to ask people to do. And so I would say, you know, where I think we found some success, or at least felt more comfortable moving forward, was connecting decisions to purpose. What's our mission? What are we trying to do? So if we are thinking in the best interest of our patients and our communities, then it's the right thing to redeploy this nurse over from a clinic to an inpatient hospital in anticipation of a surge. You know, the right thing to do in servicing and ensuring we have a stable workforce is allowing some positions to work remotely, support the people who are on the front line giving the care. So I think, as you know, I guess a piece that I have felt more comfortable with is, why are we making that decision? How does it affect our mission, our overall mission? How is it creating a better place for our patients and our communities? And then add on there certainly an aspect of our team members and ensuring it's right for our team members too. So it doesn't go without consideration, but what has to lead the decision is our patients and our communities.
Thank you. So altogether, I'm hearing using this opportunity as kind of a quality improvement moments, being very intentional with the people that you work with, and then also connecting to your mission is kind of what I'm hearing rounding out from the panel here, which is excellent insights. I did receive one question from the audience so far in terms of remote work. Is it optional? Or is there an optional element available to leaders as well? How have you handled that? Tammy, would you like to start with that one, if you could speak to that?
Yeah, we do have that option available to all of our leaders. We have stressed that if your team is in person, you need to be there with them. So if the work requires that, you need to be with them. Now, that's not to say that we don't have, because we've built all of this as flexible work across the board, and whatever that flex looks like for you. But we've really asked our executive team to lead out, and they have, by their actions. They've been the first to really test out a lot of our technology and our processes when it comes to remote meetings and hybrid meetings. And they've purposefully had people in office and remote just to test out what it means. And then they share their experiences with the rest of the organization. And so that's been a great benefit to watch them kind of be the first to struggle with what this looks like, and to really find some solutions that work for not only them, but then we learn from. So we have made it available to all leaders across the board.
Awesome. And how about at your organization, Lauren?
Yes, very similar. If your team is on site, you as a leader need to be on site. Doesn't mean you can't have some flexibility here or there. If your team is fully remote, then no need for you to be in. You can be fully remote with your team. So I would say majority of the staff that are in this position, or leaders that are in this position, are probably going to cover a hybrid. It will probably end up being hybrid, but what we're asking them to do is one, you need to be supportive of your team, and so what your team is doing, you should be modeling.
Excellent, thank you. Victoria, I know you've had the more academic lens. I didn't want to leave you out though. Is there anything related to the options available to leaders at your university that you'd like to comment on?
Sure. I just wanted to build on what Lauren just mentioned here at the end about role modeling. So, you know, one of the broader kind of bigger picture questions that's floated around is, when organizations have policies that support remote work, hybrid work, or just general workplace flexibility, but leaders are always in the office. And what does that communicate then, you know, to employees about policies versus expected norms and what we're expected to follow? So in these situations where we have hybrid teams or fully remote teams, there are ample opportunities for leaders to embrace that and role model that as well, because that gives some of that psychological permission to employees to do the same.
Excellent, thank you. I don't believe we have any other questions from our audience that I can see. So I think what I'm going to do here is round up by saying thank you to Lauren, Vicki, and Tammy for joining us today. I think this has been an excellent discussion and really useful for the healthcare community as a whole to listen to, and the different experiences that you've each had with remote and hybrid work. With that, I'm going to share my screen really quickly here. Thank you for attending today. You can visit NCHL at nchl.org. If you have any questions about today's session, please email us at info@nchl.org with any questions. And we'd love to see you on all future events. Again, thank you so much for joining us today, and to our panelists. I hope everyone has a great day. Bye, everyone.
Thank you. Bye.